One of the questions I commonly get asked by my patients is, what do you do for therapy? How do you help people? Well, when it comes to head injuries, head traumas, neurological conditions, um, basically, the more tools you have at your disposal, or the greater your knowledge is on how the brain works, how nerves work, how the muscles integrate, all those things kind of really dictate your ability to kind of help someone get better. So it doesn't matter if you're a occupational therapist, physiotherapist, chiropractor, acupuncturist, naturopath, if you have a good understanding of nutrition and it's within your scope to kind of apply changes and deliver appropriate therapies for the patients within that field, perfect. You'll be a great candidate to help those individuals. Now, when it comes to head trauma, the biggest factor is usually how great is your understanding of the injury of that patient's head trauma. So if that patient has more of a vestibular injury, where either maybe they're having it's a problem with the vestibular system itself, or it's a problem within the cerebellum, or the integration between the pontocerebellar area, if you really understand kind of those little differences, those little nuances, you'll be able to apply therapies that are more specific for those types of head injuries. So with that type of person, potentially we'll be doing some core stabilizing therapies, potentially doing some balance, some hand-eye coordination therapies. So maybe some rotational therapies where we integrate more of that vestibular system as well. So if we're looking at another patient where potentially they're having a little bit more problems with the frontal lobe, I might be making them do a little bit more, maybe some saccadic eye movements, as those saccades are frontally, a little bit more frontal lobe driven. I might make them do a little bit more short-term memory, maybe some concentrating tasks, maybe some multitasking. So in terms of the therapies themselves, well, they do change quite significantly from patient to patient, but generally speaking, the therapies are always very simplistic in nature. They're simple because a lot of times when you have a head trauma, simple tasks, although they might be easy, might be difficult for you to actually perform them themselves. And the more simple the task is, the more likely you are to kind of target a specific part of your brain and really start pushing on that brain center to initiate that rehabilitation. So when it comes to head trauma, sometimes simplicity is amazing. It does wonders. And depending on the extent of the injury, you kind of have to increase the complexity of the task to kind of make that a little bit more challenging to the patient, to push them a little bit harder. So when it really comes down to what kind of therapies I do, not quite a simple answer. It's really dictated by the patients themselves and what kind of trauma they have to their brain. But generally speaking, doing some balance, hand and eye coordination, some reaction time, some vision therapy where they're tracking certain things. So it's really kind of the therapies are endless in terms of what you can do. It really kind of is based off of what knowledge base you have and kind of what falls within the scope of practice of what you can do.